Hey, thank all of you for taking the time to join in today on this telephone discussion. This is Steve Bullock, Governor. If you have a question today, press 0, and that puts you into the questioning queue or it raises your hand. As Governor, I've always appreciated the opportunity to visit Montanans out in their communities. Really found that's the best way to learn firsthand about sort of challenges facing communities, how we can work together to find solutions. Obviously, that's not as possible at this time as we implement what are necessary social distancing measures and doing so to try to get in front of this virus. So I thank you for joining in today's call. I think that press has done a great job of providing information, and we're trying to have at least 2 opportunities each week for the media to ask questions. However, in these challenging times, it's especially important that I can hear from Montanans directly and answer their questions as we work to address the public health and the economic health concerns caused by COVID-19. And that's why we decided to do this today. So again, do press 0 if you do have a question. Now, my priority is protecting the health and safety of Montanans and helping every Montanan who's been hurt by the economic impact of this pandemic. As governor, like governors all across the country, I really do view this through a lens of a public health and an economic challenge that's impacting the communities and individuals we serve. And in order to have a healthy economy, though, we have to have a healthy population. The sooner that we can get our arms around this virus, the sooner that we can get our growing economy thriving again. We really are taking, I think, the right steps at the right time to slow the spread of COVID-19 in consultation with public health and emergency response experts. We did get an early start in Montana in both preparing and responding. We've taken aggressive actions to slow the spread, to limit gatherings, and keep Montanans close to home during this critical period. Recognizing that in Montana we face some really unique challenges, being sort of one big small town with a long roads, we stayed home for 3 main reasons. First, staying at home and only doing essential travel will give our healthcare facilities more opportunity to both secure adequate hospital supplies and be prepared so when we have our peak of cases that we really are fully prepared. Second, staying at home will help to protect our rural communities and our rural healthcare workers. We can't forget that we're a state where there's often long distances to access care, and an outbreak in a rural community could really overrun a local healthcare facility. And staying at home now will help us to take steps to reopen back up sooner than later to rebuild to a thriving economy. Managing this public health crisis now will help to prevent long-term consequences that could upend our economy for longer duration and with a worse outcome. We're also working to ramp up efforts to further test and trace those that are positive and prepare hospitals for potential influx of patients, while making sure that our frontline workers have enough personal protective equipment to take care of both them and us. These are actions that will allow us to open up back sooner than later. Same time, I certainly recognize and know that Montanans are hurting. I understand that so many are experiencing economic and financial hardships, particularly those who've been laid off, had their hours cut, had to take a leave of absence from their jobs. And I recognize that this is a time of uncertainty, particularly for Montana families across our state, whose lives look a heck of a lot different than they did a month ago. We need to get money into people's pockets. It's been a little over 2 weeks since Congress passed the Coronavirus Aid, Relief, and Economic Security Act, that CARES Act they call it, which is supposed to support and bolster our state efforts in providing economic stability and revitalization. In many areas, we're still waiting on federal guidance and for the funding to come to our state. And I think Montanans do need help now, and Americans need help now. But certainly won't stop fighting for Montanans till health and economic needs are met through that federal support. And at the same time, we'll continue to do everything we can at the state level to help Montanans obtain economic stability that they need during this time. But now I'd like to take the rest of our time together this afternoon to answer questions from those on the line. Remember, again, you can press 0 if you do have a question. I also have members of the state's COVID-19 task force, some of our experts in public health, emergency response, and economic development here with me today, too. This includes Lieutenant Governor Mike Cooney, Adjutant General Matthew Quinn, the Department of Public Health and Human Services Director, Sheila Hogan, our state's Chief Medical Officer, Dr. Greg Holzman, the Commissioner for the Department of Labor and Industry, Brendan Nordland, and the Department of Commerce Director, Tara Rice. With that, we'll now turn it over for the first question.
So I just want to advise everybody again to please press 0 if you have a question. That will raise your hand and get you in the queue.
Okay.
So the first question comes from Tracy in Helena, Montana. Tracy?
Hello, Governor.
Hey.
Hi. My question is, has there ever been any thought of having preparations for temporary hospitals in the state to handle any...
Over the last week and a half, members of the Army Corps of Engineers that were traveling around the state, taking a look at what it might take to stand up temporary hospitals. So two different things, one of which that we've identified some sites and what it will take to the extent that that becomes necessary, and are actually moving forward, even with the thought that it's better to plan and prepare rather than panic. Secondarily, though, in addition to sort of the thought of what it would take to stand up temporary hospitals, we have been working with the Montana Hospital Association and others on surge plans. So let's say that you're in Helena and all of a sudden there become significant challenges, how we could actually bring resources from other communities in as well. So both doing the possibilities for temporary hospitals and figuring out how we can surge and bring resources from other places to a community where it's needed. That's one of the things that we provide some assistance up in Shelby with Toole County as an example.
All right. The next questioner is Kathleen from, I believe, Columbus or Columbia Falls. Kathleen, please go ahead. Kathleen, are you there?
Hi.
Kathleen?
Hi. Am I online?
Yes, ma'am.
I wanted to know, I work at KRMC as an aide, and I wanted to know, are we going to get any PPE equipment anytime soon, or are we on our own?
Yeah. Hey, Kathleen, first, thanks for working an aide at Kalispell Regional Medical Center. And it is one where I'm doing everything I can to try to make sure that you and others have the PPE that you need. We literally are getting information from hospitals and nursing homes, disaster and emergency services coordinators every single day, and have a spreadsheet of saying, here are the overall needs. It has been a degree, to tell you the truth, a bit frustrating in as much as that anything from the strategic national stockpile. So if we just go through the FEMA channels, at most, I think we finally got all of the orders to date, which is about 80,000 as an example of N95 masks, where the needs that I see from the survey are about, and the direct asks are a little over 500,000. We got about 50,000 from North Dakota. We got 10,000 from the Red Cross. I'm hoping some additional come in this week. It's orders that we've put in at the state level outside of the supply chain, meaning that it's not through the federal government or FEMA. We found a couple of suppliers that we think will get us more PPE soon. And what we do when we get it in at the state level, we just push it out immediately to places like KRMC and others. So I, and not just me, but others are working on every day to try to get a more consistent supply of PPE, because we know in order for you to do your job, we have to make sure that you have the tools that you need.
Again, if you have a question, please press 0 to raise your hand. Lois from Billings, Montana. Lois, you're on.
Hi, Governor Bullock. Yes, I'm wondering, I'm a caregiver for Consumer Direct Care Network out of Billings. And you are like giving people that are unemployment $600 extra per week. Are you going to do anything for us, caregivers and healthcare people that are going to work and jeopardizing our health to care for the people?
Thanks for the question, Lois. So the additional $600, what that is out of the CARES Act for people that are on unemployment insurance, that federally they said that unemployed workers could be eligible for an additional $600 a week in unemployed insurance. So there isn't any program right now to augment current healthcare workers to pay them more. And it's something that, as you really are on the front line, and we'll push, make that a recommendation to our congressional delegation as well. But the extra $600 is, like, we took steps right away, and we have seen significant unemployment across the state. We changed the rules so there wouldn't be a week waiting period, additional things to be able to stay job attached. The federal government made it so unemployed workers eligible for an additional $600 per week, and just getting more or less the final guidance from the federal government on how that can get out.
The next caller is Kathleen from Missoula. Kathleen, you're on.
Hi, Governor Bullock. I want to thank you for the leadership that you've taken on this issue. I think your early action has served Montanans well. I'm a school teacher in Missoula, and probably the biggest question or number one question I get from my students is, are we going back to school this year? I know your decision to only schedule 2 weeks at a time is to meet our unique needs here in the state, but I'm wondering if you would consider a view that takes into account the need for stability for students and their desires to know what to expect for the rest of the school year.
Thanks, Kathleen, for the question, and thanks, and I say that not just as a governor, but also as a parent. I have a 7th grader, a 9th grader, and a senior in high school that are doing remote learning right now. And as you note, I've been putting this in 2-week increments in as much as that what I want to do is be taking a look at how much testing we're doing, the number of positive cases we are getting, and the possibility, even though it might look a little bit different than before, the possibility of reopening both parts of our economy and potentially parts of our school. And I know that, it was actually a month ago today where by declaration we said that all schools are going to switch to remote learning. And I get the desire of folks to know what's it going to look like a month from now or 7 weeks from now. I personally think it wouldn't be unwise to say, all right, we're going to, at this point, with what we know, even though this is rapid and dynamic time, to say, no matter what, this is a decision that's going to be made for the next 7 weeks. And I say that both because I think that teachers and administrators and folks have been doing a heck of a good job in trying to provide education in what is a unique time. But if there were the possibilities to do it safely, I also know that kids, and I see that in my own family, I mean, it's a big disconnect. It's a big difference when what we're providing now, and especially for our at-risk populations, I think it's even that much harder for the kids to get the services that they need. So I'll try to be as transparent as possible. I just think that as we've taken aggressive actions, as we've been taking good steps, that I'm not prepared to say that we should more or less write off the rest of the school year, because things could change where I've talked to a lot of teachers that were like, boy, I'd love to be able to see my kiddos again. And I know that a lot of kids would feel the same.
Again, if you'd like to ask a question, please press 0 to raise your hand. The next caller is Joe from Troy. Joe, go ahead, you're on.
Yeah, I'd also like to thank you, Governor Bullock, for doing such a great job. And I'd like to know how long the stay-at-home order will last in Montana. Do you have any idea?
Yeah, and Joe, I don't. I mean, right now it's extended until April 24th. And
okay.
I've been doing it in 2-week periods, in as much as that trying to say and talking to public health folks, looking at what our rates of infections are and testing, I'd love to be able to open things up just like every Montanan as soon as we safely can. But it's those actions that we've been taking by the social distancing, by spending more time at home, that I think really is helping us flatten this curve and not getting the rates of infection that we could. So I don't want to have it in place any longer than what's necessary. Now, but I will also say that even when that's lifted, there'll probably be some discouragement from getting together in large groups and sort of getting back to normal, because we want to sort of reopen things in a way that doesn't jeopardize the work that we've done or immediately put us in a position where we could even be in a worse place. But having regular discussions with health experts as well as others all the time as we look at these orders.
Our next caller is Don from Billings. Don, you're on.
Oh. Hello, Governor Bullock. I thought I'd pose this question. I've been listening to what you're discussing, and everything seems to revolve back around testing. And I am a retired postal worker, and we discussed situations, scenarios like this way back when they set up the infrastructure, because we deliver to every single address in the entire United States, and in particular Montana. We have every mailbox covered, all rural routes, all the city deliveries. Why can't they accumulate enough testing kits, or say I know they're working on the antibody test, and they would be able to sit there and deliver, say, a bundle of 4 testing kits at each address, and if you've already been tested, they could be returned to the public health. If you have to be tested, then you could do the sampling and send it back through the post office. They would pick it up and deliver it, but they'd pick it up, and you would put your phone number and name on, because it'd come addressed to occupant, and you could return it, and then they'd get notified whether they're positive or not, or been exposed, whichever test they're using. And that would solve your problem of getting every single individual in the state tested. And you know, being a senior citizen, I'm concerned about who I'm exposed to because I have underlying conditions that compromise my health. So I would like to know if they've even considered that idea. I mean, nationwide they could do this since we do deliver to every single address in the entire United States. And we know how many people are on each route, or families anyways, because of that system that we've developed for counting routes.
You bet. And thanks for the question, Don. A couple of different things, one of which is if anybody does have symptoms, we really are encouraging them, first of all, to talk to a healthcare provider and get tested, because one of the ways that we actually can control this is making sure that those that are COVID-19 positive are getting tested. Then the local health departments actually, we call it contact tracing, go out and try to find everybody else that they've talked to that might have gotten positively or that could have been infected with COVID-19. Directly to your question of testing everybody through antibody testing or others, first and foremost, that in this month where we've had a state of emergency and we've seen the increases, we haven't gotten enough necessarily testing. We've been able to test everyone that a healthcare provider says that they should, and this isn't just in Montana, this is across the country. It's been a challenge with the supply chains of getting adequate testing so that you could get to a place where you were testing everybody that wanted to, not just everybody that had symptoms. It should be this week, actually. I was on a call just this morning with the Federal Coronavirus Task Force team, which includes the Vice President, the head of FEMA, and a woman named Dr. Burks. Dr. Burks said that just this week they anticipate that the first antibody testing might be approved through the FDA. The more that we can get out testing, and we're working with both local docs and healthcare providers to ensure that that testing is possible, I think that helps us better understand the challenges. And at some point when we get to antibody testing, which hopefully will be soon, well, that won't provide us all of the answers because there's at times a lot more false positives and negatives through that, but it's going to be another tool, and the more of that we can get out, I think the better.
All right, thank you. And the next caller is Conrad from Helena. Conrad, you're on.
Yeah, Governor Bullock, thank you for taking my call. One thing I wanted to mention, as you know, the hot spots are mainly in the East Coast, the biggest ones in New York and New Jersey, et cetera. Well, today's news is saying that the governors from New York, New Jersey, Connecticut, Pennsylvania, Rhode Island, and Delaware are announcing that they're going to work together on a plan to reopen their region's economies, schools, and other important areas. Anyway, they're working immediately on that. And that's the nation's hotspot. I'm looking at the stats here in Montana, 394 cases out of a population of 1 million. That's 0.04%. And you're talking about keeping us shut down. Do you have a plan similar to what the governors on the East Coast are doing? Are you going to work with anybody? Is there a quantifiable plan we can bank on to get our economy back on the right foot?
You bet. Thanks for the question, Conrad. And I've actually spoken to some of those governors on the East Coast as they're doing that. And what they did today is just announce that they're going to work together, recognizing that from a regional perspective, to start putting out, giving the thought to the metrics of when they might be able to, put together a plan or reopen fast to the economy. But what they're not saying is that this is going to happen tomorrow or in a week. And at the same level, we're having discussions in Montana of what it would take to reopen. And I recognize that, in part because of the aggressive actions that we've taken, I don't want to become a hot spot. Yet we've already had in some of our communities, as you talk about the overall numbers, if Gallatin County was the state as an example, it would be probably in the top 10. So we also have some unique challenges when it comes to rural health care. Directly the question of, though, that no, we're not just managing this with the thought of keeping everything shut down. We're looking at what the metrics are when we can start reopening our economy, because I, like you and everybody else, want to get things open as soon as we safely can.
Thank you very much. Now the next questioner is Marilyn from Polson.
Good afternoon, Governor. Sir, you know Polson sits on Flathead Lake, which automatically makes us a recreation area. And I'm concerned because I'm not sure how this happened, but we still only have a reported 5 cases here in Lake County. I'm not sure how that happened, but I'm concerned. I work for the largest employer in the world. I'm concerned because we have people already coming into our store from out of state, and as far as New York even. And I am certain that if we get hit, it's going to be from the tourists coming, because they're desperate to get out of, thousands of people are dying every day in New York. People want to get out of that, okay? And they don't want to get on an airplane, so they're getting in cars, and they're driving here. I'm concerned. I'm 66. I have pre-existing conditions, and I'm being very careful with masks and gloves. All of us at Walmart, they take our temperature every day when we get to work. But what are we going to do about these other people that aren't really taking our health and our well-being in regards to coming here as a tourist?
Yeah, and thanks for the question, Marilyn, and thanks for the work that you do. That it is concerning to me, just as it's concerning to you. We've taken some steps so there's a mandatory 2-week quarantine if someone's coming to Montana and for non-work purposes, meaning like they may only be here for a handful of days. If they're coming here and thinking this is the place to more or less ride out the COVID-19 pandemic, we're strongly trying to discourage that. Mandatory quarantine, if you come by flying, by airplane, we have National Guard soldiers that are temperature checking people, telling them about the 2-week quarantine. If you're driving, we now have reader boards up along the highway announcing the 2-week quarantine, trying to discourage it through telling our Department of Commerce reached out to those that are doing sort of the Airbnb and other rentals to provide those announcements. We love our tourists in Montana, but we don't love it if what they're doing is coming at a time where we're otherwise staying at home. So I'll continue to push on that. I also, if there are large gatherings and things that are occurring from folks from out of state, it's also time to reach out to local public health officials. But it is something that we did that we announced that the travel quarantine on March 30th, and we're continuing to try to underscore that we don't want folks coming here from that perspective.
Thank you very much, Marilyn. Our next questioner is Vicki from Billings. Vicki, you're on.
Vicki, if you unmute your phone, I think you could be on.
Why don't we, Vicki, if you're not there, We'll move to Jerry from Hilger. Jerry, you are on. Jerry, are you there?
Uh-oh.
Are you there?
Oh,
Yeah, I'm here.
Jerry.
All right, Jerry.
Do you want me to ask the question again from previous?
Yeah, if you.
Oh, sure. Yeah.
Okay.
Yeah, we didn't hear it, Jerry.
Okay. We see all the food banks running out of food, and I'm as an agriculture livestock producer. Our prices are just crashed in the last 2 weeks, and we see them throwing away food on the TVs. What can the governor, can you get a hold and get some teeth into our senators and congressmen? I've been in contact with them to no avail. They say they're studying the issue. I'd like your comment on that, please. Thank you.
Yeah, thanks for the question, Jerry. A couple different things. I mean, we did have the opportunity we doubled about the supply of food commodities coming from the federal government that's provided into the food banks. So that's a great, some nonprofits like the Town Pump Foundation stepped up, provided another $1 million of food or purchasing power money for the food banks to purchase food. The greater issues too of both prices crashing and where the pressure that we can continue to put on will continue to underscore both to the federal authorities. We're also looking at, are there any state programs that we can provide along the way? But it really is, especially at a time where so many people are economically hit, the food insecurity is only increasing. Those on SNAP benefits can continue receiving that assistance for at least 6 months. We're making it easier for new mothers and those caring for young children to access supplemental program for women, infants, and children. And have gotten some additional, certainly, commodities for the food banks. But it is one, especially then at the same time where our prices are a challenge that, I mean, it's good that our overall food supply, meaning those chains, haven't all broken down, but I think you're absolutely correct in as much as that there's folks in real need out there.
Thanks very much, Jerry. Vicki, we're going to try to see if we can get you back on the line. Vicki, you're up next from Billings.
Hello?
Vicki. Hi, Vicki.
Why do you guys keep muting me?
Didn't mean to. Go ahead.
Hello?
Hi, Vicki. Can you hear me?
Hello? Yes.
Go ahead.
Hello?
With your question. Go ahead with your question. I think, well, why don't I try to answer it, Vicki, and hopefully we get it right, because I think you had said to someone before, are they going to make people wear masks when they're in public? Tried to go to the grocery store, no one had a mask on. And those other people are exposing us who are trying to stay safe. I did put out encouragement for individuals. If you're out into a place like a grocery store, that I am encouraging individuals to wear masks. And those masks could be anything from a bandana or a cloth buff, not necessarily what it's used for our doctors. And that does help protect everyone. So if individuals are going out, and that's consistent with the Center for Disease Control guidelines, not that one has to wear a mask everywhere, but if you're going to those places of public gatherings, like grocery stores, would strongly encourage Montanans to wear masks.
Thanks, Vicki. The next person is Jan from Fort Time. Jan? Jan, you're on.
Oh, Tim's on.
Oh, Tim is on. My mistake. Sorry, Tim. You're on. Tim from Billings is on.
Hello.
Hey, Tim, go ahead.
This is Tim in Great Falls.
Hey, Tim.
Yes, sir. I want to thank you and your administration for all your hard work and your efforts to keep us safe. I'd like to know about the upcoming property tax problem. I do have a couple of rentals. My renters are laid off, and it's going to be a struggle to try to make our property taxes. I know it has a snowball effect. What can be done, and what's the plan for that? And thank you.
Thanks for the question, Tim. Two different things. Yes, the property taxes are due May 31st. One of the challenges of that is that just about, the vast majority, I think it's 80% of all property taxes collected, it's not money that the state holds, it's what local government is using to fund its services. We are having discussions with Department of Revenue and both the League of Cities and Towns and MACO about what might be able to be done. There's discussion about another federal bill that could actually go in part to address some of the declines in local government revenue and state government revenue so that they could still provide the services even when then either they're deferring collection of taxes or not collecting taxes. Then the other issue is you have renters that we are and will be announcing today an effort to work with. It is a pool of money if an individual is laid off as a result of COVID or having other challenges, that they may be able to get some relief, and then that could actually go to you as a landlord as well.
All right. The next caller is Jan from Fortine. Jan, are you on?
Yes, I am. I'm looking at... Hello?
Hi, Jan. Go ahead.
Yes, I'm looking at the county confirmed cases map online. And first of all, I understand that you're putting the numbers down of those that you have tested that have been confirmed, but it also gives a false sense of security looking at all the counties, if I happen to live in one, that has nothing. And I think everybody equally should be aware that there could be people in those counties that don't show up on the map that have the disease. But my question is this. If you've been confirmed as having the virus, are there special things that we are doing to confine people at home? If you live far away from the store and you don't have a close neighbor or relative, are you still allowed to go to the store if you're a confirmed case? And also I wanted to know, of those that recovered, have any of them been retested and found positive again?
So I missed the last part about if you're tested positive again. What was that, Jan?
Well, you've got on the website 171 people who have been recovered. Since they've been recovered, have they in fact been retested and found to be with the virus again?
So, two different things, Jane. First of all, if someone ends up COVID-19 positive test, then yeah, they must isolate at home, and they must isolate at home for 2 weeks. And what would happen if it was in your community or county is the local public health authority would reach out, have that discussion, also have the trace contact and who all you have been in contact with during that period of time as well, then would subsequently reach out to them. To the extent that individuals have challenges with getting food or other supplies to their house, local public health actually does even discuss with them ways to get that taken care of. Because once you're COVID-19 positive, we need people to stay home for sure. Also encourage anybody that's symptomatic even once they've gotten tested, to wait until something comes back. The point of then when we also have, and the website on that, it's covid19.mt.gov, and you can click on it, and it shows the county by county map. It also has the numbers recovered, and before someone is deemed recovered, they are actually tested again in most instances. Not all instances, but in most instances they are, and there's clarity that they're no longer COVID-19 positive. You also raised, though, an important issue in as much as that just because one's county says, like you haven't seen any to date in there, like even last week we picked up a few other counties, that doesn't mean that there isn't COVID-19 positive or coronavirus positive people. That's one of the reasons why we're encouraging anyone with symptoms to certainly make sure that they get tested, or just use those CDC guidelines, or rather, if you're not tested after you've been COVID-19, using the CDC guidelines for clinical relief from isolation. Maybe I'll have Dr. Holzman, our state medical officer, pipe in and just explain that a little bit more as well. Dr. Holzman.
Sure. So yes, there's two ways that we are releasing people from isolation. One is to get 2 negative tests 24 hours apart, and then the person would be considered non-infectious and be able to leave from isolation. The other way is a clinical way of releasing. This is from guidance from the Centers for Disease Control and Prevention in Atlanta, and their recommendations are somebody needs to go 72 hours without a fever, without using any medications that would decrease their fever, like Tylenol or Motrin or something of that sort. Their symptoms must be resolving, the respiratory symptoms, and they must be at least 7 days from the start of the symptoms. So it's either using clinical guidelines that your provider can do or retesting that will release somebody from isolation.
All right, thank you very much, Jan. Next questioner is Karis from Laurel.
Hello.
Hi, Karis.
I'm here. Hi, how are you, Governor Bullock? Okay, it seems like that I'm great. Well, kind of. But, okay, it seems like us LLC and the independent contractors and sole proprietors are being put on the back burner for any kind of relief because we don't pay the unemployment tax, but we pay a boatload of self-employment tax. Can you give me some light on what you're going to do for us?
Yes, Karis, thanks for the question, too. And so one of the things that federal act, that CARES Act, not the CARES Act, the CARES Act, it does make unemployment compensation available to independent contractors, LLCs, self-employed, others that normally wouldn't be eligible for the benefits. But literally, I think it was just today or last Friday, we finally received the federal guidance on how to begin processing claims for folks like you and self-employed Montanans. Because if you really look at it, UI, it's this federal-state partnership, and federal government adopts the law, state then administers the benefits and programs. We just got that guidance, and we'll get it up as soon as we can, certainly, to make it so that you could get the benefits just like as an LLC or self-employed as others would. I mean, and look, our state has a high rate of sort of entrepreneurialism, so this expansion is going to provide economic relief to more Montanans like you, Karis. But it is, we just honestly got the guidance last Friday, and now we have to try to get the system up and running to do it.
Thank you, Karis. Next on the line is Debbie from Kalispell.
Hello.
Hello.
Hi, Debbie.
Hi. I just want to say hats off to Montana Department of Labor and Industry. They have been a big help for the self-employed independent contractors. I guess the gal before me answered the question of when the software was going to be available for us here in the state of Montana. Should it be by the end of this week, or are we going to be...
The process and where we are, Debbie, I have Brendan Nordland, who's my Commissioner of Labor and Industry, here at the table with me.
Hi, Debbie. How are you?
Good. How are you?
Good. Thank you for the compliment for the team at DLI. They are very dedicated and passionate about what they do. So as the governor said, we are working as quickly as possible to implement the pandemic unemployment assistance. That's the program for the self-employed, the independent workers, the gig workers, parents who are staying at home with kids because schools are closed and they were recently attached to the workplace. We needed to receive 3 elements of written instructions. The last one came in late Friday afternoon. We have to digest all that information and then program accordingly. So it's going to take a bit. I have to be very honest with you, but we are working as diligently and with dedicated resources to get that program up and available to self-employed.
All right, thank you, Debbie. Next we have Kenny from Missoula. Kenny, you're on.
Hey, Kenny, go ahead.
Am I there?
You sure are.
What are we doing for the prisons, the state and the Shelby prisons?
Sure. Thanks for the question, Kenny. So I did a directive, it's about 2 weeks ago, to protect both inmates and staff from COVID-19 at our state correctional facilities. Both what we implemented was best ways to prevent introduction of it into our jails or correctional facilities. And in many respects, we're going far above CDC guidance. We're following the guidelines regarding hygiene in prison and jails, limited to the greatest extent possible. It said that you can't even have transport to detention facilities or to like our state men or women's prison absent the director of the Department of Corrections at the state level agreeing to do that. Then any new transfers required to be quarantined for 14 days. Board of Pardons and Paroles also considered an early risk for older inmates who have medical conditions that might make them high risk, and inmates nearing their release date, but only where the board determines that release doesn't pose a public safety risk and that inmates can adequately receive medical care and meet supervision requirements in their community. We did a bunch of work on sort of criminal justice reform in 2017, so many of those nonviolent offenders supervised by the Department of Corrections are already serving out their sentences in a community setting. And been pleased with the work that they've been doing. Is but one example where a hot spot has been Toole County in Shelby, where we do have a significant number of cases. We haven't had any at the prison up there in Shelby.
Probably our last 2 questioners, Governor. We have Cynthia from Whitefish. Cynthia, you're on.
Cynthia,
to help.
still on.
Yes.
Go ahead.
Can you hear me?
Yes, ma'am.
Okay. There's kind of an echo here. Anyway, I appreciate all that you've done, but my question is there a model either throughout the world or locally in the United States of the steps, the actions that you would take to walk us back to normalcy? for example, no new cases for X amount of days. Is there such a model? Are you developing something like that? I just don't ever hear that.
Yeah, and thanks for the question, Cynthia. I mean, there's been a lot of models and discussion of what we might want to see. Everything from a decline in cases over a 2-week period, the availability of having even greater amounts of testing, but even recognizing then when things reopen to a greater extent than they are now, that things could still be a bit different for a while, like still really discouraging large groups of people and making sure that we have the resources so if we do get a new positive test that folks are getting contacted and we're doing the tracing so we don't have additional breakouts. So there's a lot of national discussion occurring, and I mean, I as governor are talking with my colleagues on it, that I really want to do what's unique and best for Montana, meaning that we've taken some aggressive steps. I want to make sure that we don't become a state like, not to name check them, but a North Dakota, or a New York or a Washington or even an Idaho. So we need to do everything we can on that side, and recognizing that even as we start to reopen, things might look a little bit different, because the greatest threat for this, and it's a threat for all of us, but it's certainly for those sort of older Montanans or those with existing health conditions. And I don't think that we'll get to the point anytime in the immediate future where there's just simply no more cases. It's just how can we manage the fact that this nasty virus is still out there and make it least impactful to Montanans.
Thank you very much, Cynthia. Next and last caller is Leona from Great Falls. Hi, Leona.
You might still be on mute, Leona. Leona, just in case, you said regarding testing, folks in my town who work in healthcare settings are not being tested. Will we ever be able to do that for them? A couple of different things. First of all, if anybody in your town who works in the healthcare testing is demonstrated to have any symptoms, that they actually go to the top of the list when it comes to testing. And secondarily, we are trying to work to expand testing along the way, because individuals who work in healthcare settings really need to have the assurance not only for themselves but for everyone in that healthcare setting that they're not positive and they're not potentially spreading the additional viruses. And that's another reason, though, why we're also continuing to work on getting adequate PPE, or personal protective equipment, for our healthcare workers. So know that we're doing everything that we can at the state level, then working with folks at the local and indeed the national as we try to expand testing, and also that anyone that is demonstrating symptoms, strongly encouraging them to get tested. So I'll close by thank you all for participating or taking a little bit of time out of your day. I hope this was helpful. We'll continue to also try to have regular press events and briefings so that the media can get information out to you. And going forward, we'll look at the possibility of having more of these telephone conference calls or town halls. So really appreciate both you tuning in, but also what you're doing to try to keep our neighbors and ourselves safe. I know that this has had a significant impact on all of us, and know that it's the actions that we're going to take today and tomorrow, even when we're all frustrated with this. It's really going to bend the curve, flatten the curve, or make it so that there are fewer infections going forward. That the numbers give us like all of you, I'm looking at these numbers regularly of positives and challenges, but also know that in some ways what we're seeing today can also be a part of the actions that we took days and indeed even up to 2 weeks ago. So it's important for us to continue to be that community of Montanans that we really are, and that's that we take care of one another, even those that we don't know. And by taking actions today to try to limit the spread of this and take care of ourselves and our family, we're actually taking care of our overall community. So really appreciate your taking the time and doing what needs to be done at a time that is certainly challenging to all of us. Thanks so much.